at this time, we'd like to bring on Ms. Sandra Miller Jones.
Thank you so much, Jimmy. I do appreciate being here with you this evening. It has been just a privilege to know you and to work with you over the past several years now. And I'm especially grateful to have a chance to talk with a group of entrepreneurs. I have so much respect for entrepreneurs. Having been in business now for almost 40 years, I know the ups and downs that we all are going through, and especially right now. Many of you have been reading the news about how many folks are unemployed now, and it looks like there are well over 36 million people unemployed in the United States. That was the figure in the middle of this month, and it continues to rise. Of course, as usual, African Americans have a greater burden to bear than most other folk. Our unemployment number is about almost 17% unemployment among African Americans in the US, exceeded only by Hispanics, who are almost 19%. The unemployment rates vary very much from state to state. It's as low as 8% in Connecticut and as high as 28% in Nevada. North Carolina is about in the middle of that. We're about 12.2% unemployment overall. But the really sad part, and the part that hits us tremendously, is that nearly 40% of the households that earn under $40,000 a year have at least one person unemployed in their household. So that's a lot of the folk that we know, our neighbors, our friends, our family. And of those people who are unemployed, at least half of them have lost their employee health insurance. That figure is expected to rise also over the next year. And we're looking at probably 40 million people who will be losing health insurance during this pandemic situation. Jimmy? The good news is, for many of them, is that Obamacare has provisions in that law that may enable many of these unemployed, recently unemployed folks to be able to get health insurance at an affordable rate. I'm going to tell you more about Obamacare and how you can obtain more information about it. But first, I'd like to just tell you a little about our company, because one of the things that we've been doing over the years is trying to help people to live healthier lifestyles. Jimmy? Over this 40 years, we started off our company in Chicago, Illinois, and we were there in Chicago for about 12 years with the company. Then in 1990, we decided to come back to North Carolina, where my parents were and where Lafayette's parents moved, so that we could be with our families. Over these 40 years, we have reached out to communities across the nation, and we've built teams of folk who are trying to also do outreach into their communities in the top. Now it's 35 cities. It had 30 markets on this slide, but now we're at 35. We do a number of things. We distribute free product samples, for example. We've distributed millions of free product samples throughout our communities across the nation. And we have distributed information as well. Jimmy, if you'll go. We worked for all sorts of clients, large and a few small, but mainly national brands who have an interest in reaching out to our community. And in the last, 20 years now, we focused very heavily on partnering with clients who have an interest in improving the health of our community. You see Aetna as one of those clients. And just about all of the clients that are outlined here have done things or have a mission as part of their mission to help improve the health of our communities. Jimmy? We've built networks of churches, beauty salons, barbershops, entertainment venues, other kinds of networks, senior networks, to help us to reach the families and individuals that could benefit from the services and products that we provide. We can reach, oh my goodness, my last count was 6.8 million households through our networks. And that enables us to reach at least half of the African American or Hispanic households in any major market that you choose. Jimmy? One of the ways in which we distribute information is through a custom publication that my husband and business partner, Lafayette Jones, and his team developed and continue to develop and distribute for a number of clients. I guess we've done more than 50 of these for various clients across our 40 years. Urban Call is the name of the publication, and you'll see there that our emphasis continues to be healthy living every day. Jimmy? Here is an Urban Call publication that we are distributing now that talks about ACA, the Affordable Care Act, Obamacare. Jimmy? To help you understand the Affordable Care Act, I want to just give you a few details. Jimmy? First of all, the Affordable Care Act is the law. It is sometimes called Obamacare. It was signed into law in 2010, and it continues to be the law. Jimmy? There are benefits to Obamacare insurance or Affordable Care Act insurance that many people do not know. If, for example, if you have a child or dependent who is under 26 and who is on your income tax return, they can stay on your insurance until they are 26 years old. Doesn't matter whether they're married, doesn't matter if they're in school, as long as they're part of your income tax return, you can keep them on your insurance. Also, Obamacare demands that you get free care, no cost to you, for preventive care. So you can get your annual physical, mammogram, colonoscopy, all at no cost to you, and other preventive services as well. Your immunizations at no cost. During this pandemic, if there are immunizations that you have to have, or when they come up with a vaccine, and we are praying that that'll be soon, those will be at no cost to people who have ACA insurance. There was a time when insurance companies could put you off of their insurance if your costs got too high. Cancer patients, for example, the cost could really run into millions of dollars to care for a cancer patient. And there were times when after the cost reached about $2 million, insurance companies would discontinue your insurance. That can't happen anymore, not under the Affordable Care Act. Also, if you have a pre-existing condition, you cannot be excluded from getting insurance just because of that. Even if you're in a hospital right now, you can still sign up for Obamacare, because no pre-existing conditions can be considered as people insure individuals and families. Your policy cannot be canceled for anything except fraud or non-payment. If you don't pay your premium, of course, the insurance company can cancel your policy. Or if you misled the insurance company when you got the insurance, then there can be a cancellation, but nothing else. Jimmy? Obamacare also helped to ensure that there are essential services that must be provided with every insurance policy. Prescription drug coverage, for example, has to be provided with every insurance policy. Laboratory services. If you have children, children must have oral and vision care included in your policy. Now, the oral and vision care, dental, which is of course oral, and vision is not included in adult policies, but for children, yes, it is included. And so these 10 essential benefits, many of which were not included in many insurance policies previous to Obamacare, now must be included. Jimmy? Obamacare enables people to get help paying for their health care, help paying for your premiums, help paying for your doctors. This help comes in the form of subsidies. These subsidies are provided by the federal government. The policies that are provided to people getting subsidies are the exact same policies that you get if you were to buy directly from the company. In North Carolina, for example, over the past couple of years, only Blue Cross and Blue Shield of North Carolina has offered Affordable Care Act insurance. And that means that they were the only company that was cooperating with the government to provide people who needed assistance paying for their insurance to get that insurance. Yes, Jimmy? Who can qualify for Obamacare? You must be a citizen or a national of the United States or a lawful immigrant, and you have to file your income tax return. You cannot be incarcerated. But if you have been incarcerated and are no longer incarcerated, yes, you do qualify for Obamacare. You have to have an income within a certain range. And an insider tip, you really must know what that range is before you make your application. Because if you are $1 below the required range, or then you will not be approved to get assistance or a subsidy. So you just have to have some idea of what this income range is for your particular situation. If you're on Medicaid or on Medicare, then you do not qualify for Obamacare. If you're married and living together, then you must file a joint return in order for either of you to get Obamacare. One of the qualifications, or one of the parameters that are used, is how many people are in the household. The more people are in the household, the more your income has to be in order to qualify. But also, the more people in the household, the more subsidy you're likely to get. When the question is asked on the application, and this is just an insider tip, we don't want to put that too much on a slide. But when the question is asked is how many people are in your household, the answer is not how many people actually live with you. The answer is how many people are on your tax return. That's what is considered your household. If you enroll in a plan offered through the healthcare.gov, it's also called the marketplace or the exchange. So healthcare.gov is the website that the government uses to house all of the people who are on Obamacare or who have Affordable Care Act insurance. It's also called the marketplace, and it's also called the exchange, but that is all the same thing, healthcare.gov. Jimmy? Here is a chart, and you can pull this chart up by Googling 2020 federal poverty level guidelines. This chart shows, you see under household size, that's how many people are in the household. And as I just said, that household consists of just the number of people that are on your income tax return. So if you have one person in the household and that person makes $12,000, $12,760, at least $12,760, then they qualify for Obamacare. So you can go all the way up to as much as, I'm just staying with one person, as much as $51,000. So people who make, with one person in the household, between $12,760 and $51,040 all qualify to get some assistance to pay for their health care, to get a subsidy. The less money you make, the more subsidy assistance you will receive. The more, so if you are making, you're a single person and you are making $50,000, your subsidy will be very low. If you are a single person and you are making $12,760, your subsidy will be very high. And when I say very high, it will probably cover all of your premium. So you would not have to pay a premium at all. And your doctor's visits would cost about $5. And your prescription drug cost would be as low as nothing according to what your drug is. Now let's look at 4 people in the household, mother, a father, 2 children. You must make at least $26,200, and that's everybody who is working in the household, everybody who is working, who is on your tax return. Their combined income must be at least $26,200, and it cannot exceed $103,000. All of within that range, that total range, there is some subsidy assistance that will be provided. Jimmy? Enrolling in the marketplace. Perhaps the very best thing to do to enroll in the marketplace is to work with a certified, qualified agent, insurance agent. We have a team of people that we work with to refer individuals who have an interest in enrolling or need to enroll. And we can always make a referral for you, because the agent that you work with must not only be licensed with the insurance company that will be providing, and these are private insurance companies that will be providing the insurance, but that they also must have been certified by the federal government, and it's a pretty extensive certification process, must be certified to assist you with the enrollment. Some people are able, I know that Kim was able to go directly to healthcare.gov and follow their instructions and get enrolled. Or you could call the marketplace, and we've provided a number here. But the most sure way is to work with a certified agent that has done this multiple times and knows some of the other insider tips and advantages that will assist you to get the maximum subsidy that is allowable for you. Jimmy? Just provided some contact information. You can contact us at a hotline in 24 hours or by email.
Okay, well, thank you, Ms. Jones, for the information. And I just wanted to ask, maybe someone else has some comments or questions, but what's the primary message that you just want everyone to understand?
Very simple message. If you or someone you know has lost their health insurance because they lost their job health insurance, they can get they may be able to get health insurance, affordable health insurance through the marketplace. That is the primary message.
Okay. Does any of the other masterminds have any questions or comments or questions for Ms. Jones?
I have a comment. Ms. Jones was very, very helpful for me as I obtained my insurance for medical insurance, and it was a very quick process. She's, exactly right. Everything depends on your income tax and how much money even you're going to predict to make, and that affects about how it comes back with credits. It came back instantly once I hit the submit button. Came back instantly with a results letter for me. It told me exactly what the amount of credits that I had, that actually was able to put my doctor's information so they could tell me exactly, even my medicine, it could tell me exactly what plans, and then all the plans came up so I could pick and choose which plan best fit for me. So it's a very quick process. I was very impressed by it, actually. And I just want to thank you, Sandy, for all your help on Saturday with that. So.
Yes, you're certainly welcome. And that reminds me, as Lafayette has just reminded me also, that we're talking about a national opportunity, not just North Carolina. Kim, where are you located?
I am in Carmel, Indiana.
Yeah, so for every state, there is an opportunity. And healthcare.gov can take you to whatever state you are in.
Ms. Jones, I thought that the enrollment for Marketplace had a deadline. Can you still utilize the marketplace.gov tool after the deadline is passed?
Thank you so much for asking that question.
Yes.
SEP, that's what special enrollment period. You can use this special enrollment period 60 days, within 60 days after you lose your insurance, or within 60 days before you lose your insurance. You can get a special enrollment period. So, and that's already in the law. It does not have to be passed by anybody else. It's already done.
Right now.
And people are not being told this. Yes.
So the only people who can use the SEP are folks who fall within the 60 days before or after. Someone who maybe didn't have it to begin with or didn't have it for a year, they're not going to be eligible to use the tool until next enrollment period?
That's exactly right.
Okay.
And the enrollment period is November 1st through December 15. November 1st through December 15. And when you enroll during that period, your insurance does not start until the following January.
Yes. Question regarding self-employed individuals. I work with a lot of cosmetologists who
Yes.
self-employed, but how would this apply to them?
They will not have a special enrollment period because they cannot lose their employer insurance because they're self-employed. However, they certainly can get assistance and they can get ACA insurance for next year during the open enrollment period.
Low cost.
At very low cost.
And then when you say ACA, what does that actually mean? That acronym, ACA.
Affordable Care Act.
Oh, Affordable Care Act. Okay. Thank you so much, Sandy.
Well,
Thank you so much.
Well, what we're going to do at this time, we went a little bit over, but the information was really good. And again, I want to thank Ms. Jones for providing this information this evening.